So let's talk about premenstrual syndrome. Every woman knows that things change hormonally during the course of her menstrual cycle, and she'll notice something different just before her period compared with the rest of the cycle. So most women notice a little bit of perhaps breast tenderness, slight pelvic discomfort, a bit of abdominal bloating. But for many women, it's more marked than that, and they actually find that they have quite severe mood change, perhaps become very irritable, slightly anxious, and slightly cross and out of control of their moods. And this starts to impact on their world at work, their world at home, their relationships with their partner or husband and their children, and they start to worry that they're not really in control of their own hormones and what's going on. For other women, the physical symptoms become really quite unpleasant, with nasty headaches and very severe breast tenderness and a lot of pelvic pain. And so a lot of women do come and ask for help, and quite rightly so, because there are many things that can be done to help with premenstrual syndrome. It can be as simple perhaps as just changing the contraceptive method, because a lot of modern pills actually help with the hormones and even everything out and get rid of the nastier symptoms of PMS. Other women want to take control by perhaps improving their diet and looking at what they're eating in the premenstrual part of the cycle, because certainly a lot of women express the fact that they have quite severe cravings for sweet food in the lead up to their period, and very often addressing this will help. A lot of women find that they need to exercise, and it can be very useful to go and work out in the gym in the lead up to their period, as well as at other times in the cycle, but to help with the stress and the irritability, and a lot of exercise really can help with that. Other women may want to try other things to help with PMS, because for some women, a very small proportion, it can actually be something which starts to rule their life, and they find that there are things that they don't want to do during that part of the cycle, and it can interfere with the quality of their life. But always there are things that can be done to help. And it's difficult to know as a woman whether what you're experiencing is normal and on the spectrum of normal, or whether it's a little extreme and something that you can really get to grips with, so that with some advice and help you can have a really good quality of life.